HIV is a virus that targets and weakens the body's immune system, leading to a gradual deterioration in the body's ability to fight off infections and diseases. If left untreated, HIV can progress to AIDS, acquired immunodeficiency syndrome, a life-threatening condition. Understanding and recognizing the early signs of HIV is critical in managing the disease effectively and preventing further complications. In this video, we are going to talk about the early signs of HIV in men. Here are 10 early signs of HIV in men. While HIV symptoms can vary greatly between individuals, certain signs are commonly observed in men, particularly in the early stages of infection. Recognizing these symptoms can be instrumental in seeking timely medical attention and beginning appropriate treatment. Here are the 10 key signs. Number 1. Flu-like symptoms. One of the earliest signs of HIV infection is a set of flu-like symptoms, often referred to as acute retroviral syndrome or primary HIV infection. These symptoms may appear within 2 to 4 weeks after exposure to the virus. Other symptoms are fever. A sudden, persistent fever is a common initial sign. Fatigue. Unusual tiredness that doesn't improve with rest. Sore throat. A persistent sore throat that might not respond to typical treatments. Swollen lymph nodes. Enlargement of lymph nodes, especially in the neck, armpits, or groin. Muscle aches. Body aches and joint pains similar to those experienced during the flu. These symptoms are the body's natural response to the virus and indicate that the immune system is attempting to combat the infection. However, because these symptoms resemble the common cold or flu, they are often overlooked or misdiagnosed. Number 2. Rash. Rashes can manifest as another early symptom of HIV infection. They typically appear within the first few weeks after exposure and may persist for an extended period. Characteristics are red or purple. The rash may appear red or purple, often affecting the face, trunk, or limbs. Flat or raised. Rashes can be flat or slightly raised and may become itchy or painful. Skin changes. Changes in skin texture or color, such as blotches or discoloration. An HIV-related rash is often a result of the body's immune response to the virus. It can also be a reaction to opportunistic infections that occur due to a weakened immune system. While a rash alone doesn't confirm HIV, it should prompt further investigation if it coincides with other symptoms. Number 3. Night sweats. Night sweats are episodes of excessive sweating that occur during sleep, often soaking bedding and clothing. Characteristics are profuse sweating, unusually intense sweating that may require frequent changes of clothes or sheets. Interruption of sleep. Night sweats can disrupt sleep patterns, leading to fatigue and daytime drowsiness. Recurrent episodes. Persistent or recurring night sweats may signal an underlying issue. Night sweats are commonly associated with infections, including HIV. They result from the body's response to infection and the release of inflammatory molecules as the immune system battles the virus. Number 4. Weight loss. Unintentional weight loss, often termed wasting syndrome, can occur in the early stages of HIV infection. Characteristics are noticeable loss of weight without significant changes in diet or physical activity. Loss of muscle mass, decreased muscle tone and strength, contributing to overall weight loss. Fatigue, associated with energy depletion and lack of motivation to maintain regular activities. Weight loss in HIV is typically due to the body's increased energy expenditure in fighting the virus, coupled with reduced appetite or absorption of nutrients. Unexplained weight loss can be a significant warning sign of HIV progression and warrants immediate medical attention. Number 5. Swollen lymph nodes. Lymph nodes, which are part of the immune system, can become swollen as they attempt to combat the HIV virus. Characteristics are tenderness. Enlarged lymph nodes may be tender to the touch. Location. Swelling commonly occurs in the neck, armpits, or groin. Duration. Persistent swelling that lasts beyond typical infections, such as a cold or flu. Swollen lymph nodes are often one of the first signs of HIV, as they indicate the immune system's engagement in fighting off the virus. While lymph node swelling is not exclusive to HIV, It should be evaluated if it persists or is accompanied by other symptoms. Number 6. Persistent fatigue. Chronic fatigue is a common symptom of early HIV infection, often manifesting as constant tiredness or exhaustion that doesn't improve with rest. Characteristics are constant fatigue, persistent feeling of tiredness or lack of energy, even after adequate sleep. Difficulty concentrating, struggling with focus, attention, and mental clarity. Physical weakness, reduced physical strength and endurance, making everyday tasks challenging. Fatigue in HIV may result from the body's ongoing battle against the virus, along with the stress of coping with other symptoms. Chronic fatigue should be investigated if it persists beyond typical causes or accompanies other signs of HIV. Number 7. Sores and ulcers. Sores and ulcers, particularly in the mouth or genital area, can occur as a symptom of early HIV infection. Characteristics are mouth ulcers, painful sores inside the mouth or on the lips, gums, or tongue. Genital ulcers, sores or lesions in the genital area, which may cause discomfort or pain. Persistent lesions, sores that do not heal within a typical time frame. These sores and ulcers are often a result of opportunistic infections or the immune system's response to the virus. While they are not exclusive to HIV, their persistence and recurrence should prompt further investigation. Number 8. Headaches. Frequent headaches can occur as an early symptom of HIV, often accompanied by other flu-like symptoms. Characteristics are severity. Headaches can range from mild to severe, impacting daily activities. Frequency. Persistent or recurring headaches that don't respond to typical treatments. Accompanying symptoms often occur alongside other symptoms such as fever, fatigue, or swollen lymph nodes. Headaches in HIV may result from the body's inflammatory response to the virus or opportunistic infections affecting the nervous system. While headaches are common, their persistence alongside other symptoms should raise suspicion for HIV. Number 9. Nausea and vomiting. Nausea and vomiting can occur as early symptoms of HIV, often impacting appetite and overall well-being. Characteristics are persistent nausea, constant or recurring feelings of nausea that disrupt daily life. Vomiting, episodes of vomiting that may lead to dehydration or weight loss. Loss of appetite, reduced interest in food, contributing to unintended weight loss. Nausea and vomiting in HIV may result from the body's response to the virus or side effects of opportunistic infections. While these symptoms are common in various conditions, their persistence alongside other signs should prompt consideration of HIV. Number 10. Chronic diarrhea. Chronic diarrhea is a common symptom of early HIV infection, often accompanied by other gastrointestinal issues. Characteristics are frequent bowel movements, persistent diarrhea that lasts beyond typical causes, such as a stomach bug, abdominal pain, discomfort or cramps in the abdominal area, dehydration, risk of dehydration due to fluid loss, leading to further health complications. Diarrhea in HIV may result from opportunistic infections or the body's response to the virus. Chronic diarrhea should be investigated if it persists beyond typical causes or is accompanied by other symptoms. Understanding the early signs of HIV in men and the importance of early detection is crucial for effective management and prevention. By recognizing symptoms such as flu-like symptoms, rash, night sweats, weight loss, and more, individuals can seek timely medical evaluation and begin appropriate treatment. Preventive measures, including safe sex practices, needle exchange programs, and education, play a vital role in reducing HIV transmission. Additionally, living with HIV requires adherence to treatment, a healthy lifestyle, and social support to maintain overall health and well-being. With continued efforts in education, prevention, and treatment, we can work towards a future where HIV is effectively managed and the impact of the virus is minimized, allowing individuals to lead fulfilling lives. Thank you for watching.